Welcome back, welcome back. You are still tuned in to Funtastic Fridays here on New Star 93 FM. So, listen, guys, I know we had a lot of information before this interview segment because I tell you, a big event is going to happen next week, November 14. Make sure all roads lead to Mona campus from 9 a.m. to 3 p.m. And the main reason is because November is World Diabetes Month, right? And then there's a day that we zone in on it. It's a day that we try to keep you guys informed. And we know diabetes is something we hear so often. I feel like all of us have at least one family member that has been affected by diabetes, and that is, even though that sounds very like I guessed it, it's probably very factual, right? The ratio is there. So I know you were getting a wealth of information, so I want to reintroduce the voice that you are hearing the information from is Mr. Alex Johnson, and he is a dedicated clinical dietitian intern, right? And he also has a Bachelor of Science. I'm telling you where I'm having us, so they know the information I come from somewhere. And I Google it, and I sit down in one room and write it down and say, I want to go tell the people this. No,
Chat GPT.
Not Chat GPT, right? So he holds honors, right, for his Bachelor of Science in dietetics. Right, with an instrument about the tongue, and nutrition, dietetics and nutrition, and a postgraduate diploma in dietetics and nutrition as well. And he's currently pursuing a master's in public health because that's the group that is behind this whole event. As I say, it's a great assignment, but I love about these assignments is that it's impacting persons. It's not just you're doing schoolwork, research, and submit. No, you have to actually get involved. Affects people around, impacts people, I should say, around you positively, and I love that that's what this is doing, right?
I call these kind of activities a win-win.
Yeah.
So you have some things
that you agree.
You put something on a garbage paper, and then the teacher put up on a wall one day, and the next day that's it. Right. These are actually impacting assignments, and they can actually make a difference in other person's lives.
Exactly. And the best part is that it's free with the EEE. Right? And we have to mention as well that he is the managing director and founder of Dietitian Corner JA. So listen, I must say, and I like him, just get up and make up the information. We have a wealth of knowledge here, and we're gonna, make use of that while we have it, right? So thank you for being here.
Thank you for
being here. All right, so what I want to go back to know, if it is that you just joined me,
head into our topic.
Yes, diabetes explained. Like, how many of us have just heard diabetes, heard sugar, and we don't really know what it means? Nobody ever really explained it to us, nor did we even feel the need to go and research it. We just know sugar. Or something we need to try and get, but then all the way a fight because we love the soda, we love the this, we love the that. We don't really understand what happens when we consume the soda. We don't really understand what happens when we have excessive sugar, So I want you now to go. You gave a bit of layman term earlier, but you're allowed to go a bit more deeper now into diabetes. Let's get to understand it a bit more.
Alright, so I just want to say that the World Diabetes Day's theme this year, I just had to look that one up.
Yeah, that's
is
fine.
Empowering Global Health. And this is what UE is preparing us as public health practitioners for. Empowering global health. So we're not just learning about health in Jamaica, which is our beautiful island, but we are learning about health regionally. Health on a global scale. And for diabetes is a global issue. And we are seeing in smaller, lower income countries where diabetes is a big time killer. And even in the first world countries where we expect for this excellent technology to be there and health system, we still have persons dying from diabetes. So another hat that I wear is within advocacy with the Heart Foundation of Jamaica and also with the Jamaica Youth Advocacy Network and with UNICEF. So we have been pushing for our front of label food packaging. And one person will ask how this coming to diabetes. But if we start from our consumer and guiding them into what they are eating and what is it that they are putting into their bodies, we're going to see a decline in our diabetes. Not that persons are not just going to magically start eating healthy now. But consumers will have an informed decision.
Have the
We'll be
information.
more aware.
Yes.
And I like that you mentioned that, because this is just a random moment, right? I was in the supermarket recently, and I've been trying to do the thing of reading labels. I've heard it enough around that you find yourself doing it sometimes.
Yes.
And I was just passing one, and somebody was with me, and they were like, "Hold on, let me read what's in this label." And when they read the label literally said, "For the ingredients, please send a letter to," and gave you an address. And I was like,
Email.
so I was like, so hold on, these people want, and you're going to forget, right? But I just found it so, no, you're going to forget eventually. If I get it, that's what I'm saying. That was everything I said. I was like, but that's ridiculous, because I'm going to write a letter. I don't know if the letter going to reach. I don't know how long you're going to take to get it and return it. And how many times am I going to consume this in that time period? And I've never seen that before.
I was going to give an example of a label that said to peel off the label and read on the inside.
So you have a peel it off for your bite.
Literally, and then first, you have to look all over the place first
to find
that little message that says to peel and look on the other side. So I thought that was bad, but keep it beating.
Yeah, man.
So we did a research with UNICEF and with University of Technology, where we looked on what food label would the consumers rather. And I'm telling you, it was a whopping number of persons choosing the black octagonal label. So later on, I'm going to show you guys what that looks like. Make sure I have it on my laptop. So I always show persons just to remind them what it looks like. So it just simply says high in sugar, high in saturated fat, high in this, high in that. So it is a warning label. Any age group can see this. And what we are doing is not telling persons not to buy these things. We're not telling you not to eat, because at the end of the day, persons are still going to want their fast food, their soda, stuff like
and
that.
And sometimes what they can afford. That's the reality too.
But let's not even go down to the affordability, because that is a whole discussion in itself. Because we see what Jamaicans been spending their money on. I won't call it the brand names.
And the priorities.
Not only that, too, as I said, really and truly, sometimes we just go by what we hear.
Yes.
So I like we make an informed decision. Just because say, okay, enough people buying this, so let me buy this too.
Yes.
And that's not it.
We move with the hype, but the sad reality is, and we have to be very careful, what we are seeing is that persons are now developing type 2 diabetes from earlier stages. So it's not just a elderly, not just an older adult thing, but now it's becoming an adolescent thing. And it's not just type 1 diabetes, because there are different types of diabetes.
And that was one of my questions I wanted, because we always hear type 1, type 2, and I wanted more details on that.
Diabetes mellitus, because we have different types of diabetes in the whole endocrine disorders and metabolic syndromes, but zooming in on diabetes mellitus, which is a common one, we have type 1 and type 2 diabetes mellitus, but we also have gestational diabetes. So we know we're in a space now where women are getting pregnant, and their health during pregnancy, that hormonal imbalance, they now develop what we call gestational diabetes, and that is only diabetes only while pregnant. So it is because of hormonal change that cause them to be diabetic. So they are not diabetic. But we have some of our pregnant moms who come in, and we call that they have diabetes from before. That we call that pre-GDM. So they are pre-gestational diabetes. So they had diabetes before.
I know
it now worsens during pregnancy. And then we have our type 1 diabetes, and that's usually diagnosed from childhood, and that is more when the body cannot produce insulin, or the body is totally insulin resistant. So that's usually genetical. And we see where persons for that have to start on insulin. And we do have some children with type 1 diabetes that it's a bit more complex. But then we have Mr. Type 2, and I'm tired of it. Because you look on the docket and you see DMT2, that's all you're seeing. And this one now is the one that most Jamaicans have. And this is the lifestyle one.
And this is the one that most Jamaicans can also avoid.
Yes, because this one is the one that I call you have a choice. So not because my mommy and daddy had diabetes, I am to have diabetes. There's no story that goes like that. But what that means is that I have to be more responsible in what I do, so I not have to actively exercise. And exercise does not mean joining a gym.
Yep.
So let's just get that out of the picture. Yeah.
I feel like he's been tuning in. I think he's been tuning in because I've been preaching this all year. You don't. If movement is free.
It is. And I won't really go deep into the whole exercise physiology. That's for our physical therapists. But I really want to touch on the importance of exercise at least 30 minutes per day. So we're looking at swimming, we're looking at biking. We have a big campus with a ring road. You can walk, you can jog, and it's fairly safe. Yeah, you have to walk with the blood of Jesus.
And a little shade.
Walk responsibly.
Thank
you. That's right.
And in crowds if you can, in groups.
Yes. So we want to encourage the walking and the exercising. I swim and I find that I get a full body workout. I know that I'm getting in some cardiovascular exercising. So we want to ensure that we're exercising. And guys, exercise is not just to prevent diabetes. It's to prevent obesity. It is to prevent hypertension. It's to prevent heart disease. It's to prevent you dying very quickly unnecessarily. And we need to move. If you don't move your body,
your body was created.
Because it's also aids in preventing your joints from, as Jamaicans would have said,
seize up.
So it keeps you and increases your flexibility. So back in the days when you were 12, 13, 14, you could have just run the tire lace.
And get up.
I see that's right. Probably over 30 was the thing, but probably even now 25, they must struggle to tie lace and them something. These are things because we are not keeping active, we're not moving up. So we find that earlier and earlier on in our lives, we're unable to perform simple tasks without any strain or frustration.
Yes, so we want to push physical activity. I know for sure. So we just touched on the types of diabetes, but now we have to look at spotting if there is something happening.
And that was one of my questions too. So like, what signs? If I was like, all right, I probably don't get the screening or anything, but are there signs I can notice in myself or in others?
Yes.
Yeah.
So, well, sometimes when you see the signs and symptoms, it's already late.
Yeah.
So we recommend, so not to jump from the signs and symptoms point, but we recommend screening. You must screen, and screening is just a simple finger prick, and your yearly executives where you will do what we call a HbA1c, and that test will tell you if there is an issue going on. We also have a whole blood profile that can be done on your blood glucose. So we do recommend for persons to get screened properly. So yes, you do the finger prick and you may get a high reading, but then your HbA1c can tell us for sure definitely if it's diabetes going on. So we usually recommend for persons to go and get screened. You can go to your nearest health center, you can go to UE Medical Center, you can also go to UE Hospital and just go. They have the outpatient setting. You can just go and get these checks done. And it's very important, guys. Just screen. Simple. So the signs and symptoms now, which we don't want for you to have, but these are just some stuff that you can pinpoint on, is the frequent urination. So you are in your lecture theater, you never drink that much water, and you're using the bathroom maybe 4 times in a 1 hour session, and you can't sleep the whole night. You have to be getting up every minute to urinate. So the frequent urination is one that we'll watch out for. Excessive thirst. So you're drinking water, you're just thirsty, and you're excessively hungry. No matter what you eat, and it's not that you're a meal and
you just eat only,
but you're just having excessive hunger. We want to watch out for that, because what is happening there is that your body is not regulating the glucose well. So when it does, it's when it's time to break down the glucose, the body is still yearning for more, because everything shows off. So there is going to be some changes in how your body functions. So we want to watch out for that. We want to also watch out for when you get a cut, ain't just not healing. you scratch your foot. I see Lionel.
No, look funny.
You checks in the past. No, sometimes
Yes.
you see a cut and you say, wait, this not healing. No, you have
Yeah.
to man.
So we want to ensure that persons watch out for these signs and symptoms. It can be other things, but it never hurts to get it
To just check just in case.
And we have this thought that we're young and we're focused on making the bag and all of that.
YOLO.
But but we forget our health. And I also want to touch on just how we treat our bodies. We need to sleep.
Yes.
I was about to say that
Yeah.
because you were saying, we're young and we're trying to get the bag, and then people like to say, oh, I sleep when I'm dead. You will die. It's from lack of sleep, guys.
You gotta speed
Let's not do that.
I've heard that quite often.
Yeah.
I don't know. When persons talk about death, all funny, but when death knocks at their door, it's a different conversation.
Yeah.
So, I don't want to say I'm fortunate, but I'm somewhat fortunate to see persons in that state.
Yeah.
So I
to
know what
remind
I'm
you.
talking about.
Yeah.
I'm not telling you any fairy tale. This is real life experience and words with patients, seeing them
Yeah.
in this state where they say some things like, I should have get tested earlier. I should have been checked earlier. So, we want early prevention. We want early detection as stealing
The breast cancer
but
awareness.
it's still important that we get screened, get checked, because early screenings overall, not just for diabetes, but generally, you want to make sure your body healthy and your body in the right state.
Yeah.
Because when the body stop working, there is problems.
That is true. That is true. And I know you were mentioning lifestyle, like, the preventable type of diabetes. So that leads me to my next question. What lifestyle factors contribute to diabetes? And outside of not exercising, would you say there's other things that we do habitually that also contributes?
Yes. So the excessive intake of simple carbs, which you call our sugars and stuff like that, and the excessive intake of sugars in general, or carbohydrates and stuff like that. So what we see happening is that persons are literally digging their graves with their farms. So what we encourage for persons to do is watch what they're eating, because those 3 bottles of soda is going to catch up on you. Because what people don't know is that when you see 10 grams of sugar in a bottle of soda, it's not the entire bottle.
Per serving.
It's 10 per serving. And nobody drinks 8 ounces of the soda. They're going to drink the entire bottle. So you're looking at 20 grams of sugar. And 20 divided by 4 is what? 5. So we're getting 5 teaspoons of sugar from 1 bottle of soda. And this is just hypothetical. Because the sodas are far
It's more than 10 grams. I'm
so
telling you.
we are looking at some sodas. I won't call any soda name, but some sodas have up to 50 odd
30, 40, 50. I've been checking
grams
labels.
of sugar, and when we divide that by 4, we get to our teaspoons. And when you look at that, I remember Champs last year, my company, we did the Nutrition Hub with Grace Kennedy, and we were doing the whole sugar trivia, and we're showing the athletes how much sugar was in their beverages. And I literally had students almost having like a pass out moment, because they were shocked, because now they were actually seeing the amount of sugar. They themselves were pouring the teaspoon, and they were like, whoa, this is a lot. So we want to recommend for persons. We're not just telling to eat fruits and vegetables now, but we're talking about moderation. Because for our adults, for our females, we recommend no more than 6 teaspoons of added sugar per day. And for our men, 9 teaspoons of added sugar per day. So we want to stay within our sugar recommendation. So if you drink a soda today, you can't drink a soda tomorrow, and then the other day, and then the other day. And we have some brown liquids that we like to drink. All the names, some cola flavored beverages. Those type of stuff, we like to drink a lot of them. We like to drink stuff with fizz. They say they want to belch, so they drink up some liquor.
And then sometimes we feel a little better when we drink like a fruit juice, but the fruit juice is not much better.
No, let's not even start that. So
it's not a natural fruit juice.
If it doesn't say 100% juice, it's not true fruit juice. No added sugars. So you want to ensure that you're getting that 100% fruit juice. So we have to read our labels. It's there. They put it there because they have to. But now we want it to be easier for our consumers to read. So when you are looking for juice choices, we usually recommend 100% fruit juice. And you can make your own juice at home. We at the Heart Foundation, they have so much stuff. You can go on the Global Health Advocacy Project page. There's a whole section on the healthy swaps, and you can find how to swap your sugar cravings. And for persons who don't like water, and you don't like water does clear and look like nothing, no him to it, yes, you can add your little cutlets of fruits, and you can do your flavored waters. So you can do your infused water with your lemon and your cucumbers. And so for people like me who don't want no cucumber in my water, I put watermelons, and sometimes I put grapes or different types of fruits that I know will extract some nice flavors. And I'm telling you, it does add flavor and color to your water. So if you're realizing that you're having a sugar craving, because you know sugar is more addictive than cocaine.
Yes, I was saying earlier, it's addictive.
It is addictive. So if you don't know what you're doing, I've seen persons go through sugar withdrawal, and you would think they are drug addicts. So it's serious. It's very serious. I've done 100-day water challenges before. I have done fastings away from certain things, and I've seen major benefits. I'm feeling 100-day water challenge coming up very soon. I wonder if the MPH people want to join.
I mean, you're not gonna name or you know.
No. My question is, you're talking about infusing other flavors into the water. What about those who say probably add like a squeeze of lime or some apple cider vinegar? Is that a positive move or?
Well, I've heard all of the stuff about it cut fat and it cut your nature and all sorts of stuff. But so there is no scientific evidence, and as a clinician, I can only speak to scientific evidence. I can only speak to what is tested and tried, and go through some clinical trials. And big up to Dr. James and Dr. Thoms, who has been teaching us all about these, ensuring that the data is right and correct, and we go through all these analysis and stuff, so we know when a piece of literature is put out there, we know if it is credible or not. So we have to be very careful, because social media is all good, but we have to be careful because everybody has become nutritionists, and
self-proclaimed.
So it works for them, so it must work for everybody, and nothing never goes so.
They say it work for them, and only 1 or 2 days they use it.
Listen,
and then why if you use it every day?
And some things that they are telling persons to do, they are not.
That's what I mean. They are not. They do something one day or not even do it, and said, yes, this is doing it.
But that's why they're called influencers.
Yes. Well, I will continue to be a health influencer.
No, I love that.
To get better with knowing the right thing. I won't proclaim that I eat healthy all the time. I don't. And for my MPH classmates, no, because in the nights we don't have good options where they're studying late because our classes finish late. But I know that there is a way in which you're morphing these things, a way in which you mix and match it. But I have the training. Some persons don't. Most people don't. So, it's very important for us to take these small bits of information from the health fair that's coming up. Also can get some information, but I recommend persons to see their dietitians. I recommend persons to see their dentist, because another thing too, and I don't want to leave out the oral health.
We're gonna go to the break.
Yes.
Some new hot points coming up right there.
Yes, I saw some comments on the live as well, and I want to get into some data when we come back, because we talk about all the accurate data, but we need to hear some of the statistics. So, my friends, some are into better habits, right? So, we're going to come back to this discussion after the break.
All right, let's drop some of the comments before we go. Berkland Hope, big up to you. He says number 3. I'm not sure which one the number 3 section that was for. Albert says, hey, Albert in the building.
Oh, big up, Albert.
Fruits and Ting, who also mentioned what I was talking about. What about putting lemon in the water?
Yeah.
That answer right there. Fruits and Ting, well, they actually have the whole company in mind. So blend grape, orange, and apple together. Freeze it into little ice cubes, store in the freezer.
Yes.
And use that to flavor your drink, or drop it in whatever you have. Anybody else out there, just feel free to drop your comments. We're going to go ahead
Any
and read them.
questions as well?
Any questions as well on the WhatsApp line 876
792 3530.
We'll be right back. News Talk 93.